Today, I want to talk about foggy brain. So, foggy brain, often referred to as brain fog, is a term used to describe a range of cognitive symptoms that can include difficulty concentrating, memory problems, confusion, and a feeling of mental haziness. And brain fog can be caused by various factors, and it's important to identify the underlying causes and to address that underlying cause. Everybody's different, everyone's unique, and we have to get to the bottom of what's causing the brain fog for you. So I want to talk about some potential causes, and then in the next video, we're going to talk about some ways to deal with that. So one of them can be sleep issues, poor quality sleep, insufficient sleep, sleeping disorders like insomnia or sleep apnea, and the poor quality sleep being disrupted can really cause to lead to cognitive difficulties or what we call brain fog. Stress and anxiety is another one. Again, we talked about that earlier. High stress and chronic stress really leads to anxiety, and that affects our cognitive function, and it leads to difficulty focusing and thinking clearly. You know yourself, when you're really under a lot of stress, you just can't think straight. And our brain is going a mile a minute and we're just not really concentrating on one thing. We often thought that we could really multitask, and now they're finding that that's just doesn't really work that well, that we really should be concentrating on just one thing. Medical conditions such as fibromyalgia, chronic fatigue syndrome, a lot of autoimmune disorders, thyroid imbalances, diabetes, infections, those all contribute to brain fog. Medications certainly do, such as antihistamines, sedatives, pain medications, antidepressants, and they all have a cognitive side effect, and that causes brain fog. Diet and nutrition, poor nutrition, dehydration, fluctuations in our blood sugar levels, that all leads to brain fog, especially as our insulin levels go up and down. That really can cause us to feel very foggy. Hormonal changes, again, such as the fluctuations during menstruation and pregnancy and menopause, that affects our cognitive function, and it really does lead to brain fog. Again, it could be some mental health disorders like bipolar or other mental health conditions, and especially if they're on medication, that really causes brain fog. It's one reason a lot of people that suffer from mental illness stop taking their medication, because they just can't think straight. They just feel what they say is icky. They have side effects and tremors and things, and then they go off the medication, and then that causes issues too. So it's a horse apiece. Chronic inflammation. Most people don't realize this, but chronic inflammation in the body, often associated with conditions like dietary factors, it all can affect our cognitive function. Again, as I said earlier, 90% of our issues, our health issues, start in the gut. So we really need to get that gut healthy, and that doesn't happen overnight. We have to be patient, but it's amazing that once you have a healthy gut, you'll sleep better, you'll think better, you have less joint pain. All of these things that we're talking about in this course will go away, or at least get a whole lot better. Lack of physical activity is another one. Sedentary lifestyle and lack of regular exercise can impact our blood flow to the brain, and that causes brain fog. There's environmental pollution, allergens, environmental toxins, that all affects us. A lot of people are allergic to the pollen that was so high this summer and the dust, and that really affects our brain function. Allergies and sensitivities, as I said, caffeine and stimulant use is another one. Overuse of caffeine and stimulants can lead to crashes and cognitive difficulties. Brain trauma or an injury, past head injuries or trauma to the brain, can sometimes lead to cognitive issues, including brain fog. And that's things like concussions with playing sports, in a car accident, being bumped in the head. We know that if someone has had at least 3 concussions, they have a lot of sleep issues, they have brain fog, they have anxiety issues, they have anger issues, and all of those need to be looked at and addressed, and we can teach people how to deal with that when that happens. There's circadian rhythm disruptions in our body's internal clock due to irregular sleep patterns or shift work, as I talked earlier. Those really affect our brain and cause it to be foggy. And aging, a normal age-related changes in brain function can lead to cognitive changes and mild cognitive impairment. And people are living longer, and so there are a lot more people that have issues with foggy brain, and they also, many of them develop Alzheimer's, and they also develop dementia. And we're finding now that a lot of those health issues are being caused by toxin. Mold is one severe one, and inflammation in the body is another one. So we really need to take a look at what we do when we do functional medicine, is we look at your genetics. What have your parents had or your grandparents had? We look at any trauma you've had, concussions, any of other trauma or injuries to the brain and to the head. And we add all of those up, and then we look at what is really causing the brain fog. And so if you're experiencing persistent brain fog or real cognitive difficulties, it's important to consult again a healthcare provider, and if they can determine the underlying cause, and then they'll recommend treatment and interventions to address the issue. But most of the time, lifestyle changes, dietary adjustments, stress management techniques, and medical treatments, or treatments with vitamins and herbs and supplements, can really improve cognitive function and alleviate that foggy brain or brain fog. And so I have so many tips and tricks in this ultimate health quest that we can explore. But in the next video, I'm going to touch on some of them that we can start incorporating right now. See you soon.